And today I am here to help you out, to guide you in your way to prepare for this exam, and I'm there with you in your journey. So let's begin with how to clear your exam in the first go. So for that, you should be clear about the exam format, how you should know your exam. Okay, so let's begin with what is the format of this exam. So talking about part one, which consists of FOP and TAs. So FOP, it basically focuses on the basic pediatric knowledge and the applied skill. Okay, whereas TS, which is also part of MRCPCH Part 1 exam, focuses on scientific principle. So what does it mean? So the FOP exam basically gives you a clinical scenario. Maybe they'll give you question in which they have asked you about they have mentioned about the clinical features of congenital adrenal hyperplasia, right? And then they might even um, give you the hint that it is a first week newborn baby and presented to you with severe dehydration, vomiting, and you land up with a report which suggests hyponatremia, hyperkalemia, and there is hypoglycemia. So, with all the clinical information, you need to come to the diagnosis of congenital adrenal hyperplasia. And in the second step, you may even need to tell them the first line of management, right? So that's what FOP tries to judge, your clinical skill, your clinical knowledge. Whereas TS exam, so it basically focuses on the basic sciences. Basic sciences includes physiology, pathology, pharmacology related to pediatrics. So, considering the same congenital adrenal hyperplasia, how will they frame their question? They may frame their question in such a way that they'll ask you um, which which component is basically deficient in congenital adrenal hyperplasia. So you need to tell them that okay, it's there is deficiency of mineral corticoid, there is deficiency of glucocorticoid, and there is excess of androgen and sex cortisone. Okay, and that's the principle behind the salt wasting crisis, and also virilization in females, and also precocious puberty in males, right? So this is relating with the pathology behind the congenital adrenal hyperplasia, and it's somewhat correlating to the the clinical aspect of the pediatrics, right? So that's the difference between questions that you get in FOP and TS. And you get best of five kind of questions, which means that with a question, you get five options and you have to choose one of it. Okay, so one option out of all those five options is the correct one. So that's about your part one exam. Then there is part two exam, which is AKP, and which consists of question which judges your clinical reasoning. Now, what do I mean by that? So, in the same scenario of a congenital adrenal hyperplasia, you know you may even need to tell them like which investigation will you go for in the initial period, right? So if you are given a clinical picture of CAH, along with that you have the blood reports, and you are quite you know you have basically formed your differential diagnosis, and you're putting congenital adrenal hyperplasia in the first um, differentials. So how do you proceed now? How do you go about? And with the ambiguous genitalia given to you in the picture, when do you send the karyotype? When do you send 17 hydroxyprogesterone level? And what are the other reports that you need to get? Is something which you would be asked in AKP. Also, with that, they ask you questions related to ethics and safeguarding, which is also a part of part one exam. But yes, AKP is a little more advanced version of what you asked in FOP, right? So that's AKP for you, and it consists of best of five questions, as I explained just now. And there are also EMQs. EMQs are extended matching questions, which means that you will be given a question, you will be given 6 to 8 options, and further, first of all, there will be a clinical scenario then 6 to 8 options, and then there will be 3 small questions which will be related to that clinical scenario. And those 3 small questions will have one of the option correct, which has been given above. That is, the 6 to 8 options which are given to you, one of it would be matching with the 3 questions given, right? So that's extended matching question. But I guess most of you here are the ones who are preparing for part 1 exam. And please do also let me know at which stage of preparation are you guys, so that I focus on that part and make this session fruitful for you. Next comes clinical exam, which is the last one that you appear for. So to make you guys clear of the fact that the theory exams, which consist of FOP, TAS, and AKP, can be appeared in any sequence. So you need not follow the typical pattern of giving part 1 first, followed by part 2. You can even give part 2 and then part 1. But clinical exam is one which you can give only after you clear your theory exams. Okay, so the eligibility of clinical exam is the fact that you should have cleared your theory exam. Okay, and clinical exam, definitely it judges your practical skills, and it is OSCE based exam, right? So moving ahead, this is the syllabus that your part 1 exam primarily comprises of. So there is adolescent health medicine, behavioral medicine, cardiology, dermatology, emergency medicine, endocrine growth, ethics and law, gastro, hepato, genetics, hematonco, infection, metabolic, musculoskeletal, and a lot more. Now, out of all these, let me highlight to you the topics which we tend to ignore, but becomes important when you are preparing for part 1 exam. So it's this: ethics and law, right? Palliative care and pain medicine, patient safety and clinical governance, safeguarding, pharmacology. I'm putting a star because this is the star subject of this exam. Okay, so pharmacology is something which is very much important for your TS exam. Yes, doctor. So this syllabus is common for FOP and TS. And having mentioned this statement, I would also want to tell you that there are some people who ask me if they can give their FOP and TS together, or should it be better for for them to appear separately. So let me first tell you the fact that the syllabus for FOP and TS is very same. Okay, it's just the difference in the question which is there, which makes both the exam different, but the syllabus is same, and you need to go through the same topics for both exams. So I primarily suggest that it's better to go for both of them together. But if you are someone who has been away from academics since long, and you feel that you're not very confident to give it give both the exam together, it's okay to give it one by one, no issues. You can have your time, you can read through one of it and then appear. But if you have this slightest will of appearing for both of them together, I would say go ahead. Okay, then comes ophthalmology, which is again a very important thing considering your part 1 exam. And trust me, ophthalmology is something which we run away from because it seems a little complicated, the pathways, the muscles. But once you get a hang of it, this is a very scoring subtopic. Okay. So ophthalmology is something which I would say you must do before your exam, because it's scoring. Then comes your genetics. So genetics is again something which is very important for your part 1 exam. They love to ask you questions from genetics, which includes, pedigree charts are something which is very commonly asked. And they like to ask Prader-Willi, Angelman syndrome, and then syndromes like Williams syndrome and Dijon syndrome. So Marfan syndrome, and many named syndromes which are commonly asked from genetics are quite interesting and also scoring. And again, it is one of those topics which we want to run away from, but it again, becomes a point where you can, get extra edge. So if you're good with genetics, you get that extra edge and you tend to score more. Then comes ethics and law, again, something which we usually do not learn or do not study separately during our residency days or during our pediatric graduation, post-graduation days. But it holds a lot of importance considering your MRCPCH exam, and this will be there with you in all the parts that you give, okay? And with all that, you have biostatistics, okay? So statistics is again something which is very important for part 1 exam and especially TS exam. So FOP exam does not have much questions from biostatistics, but it is your TS exam which has questions from it. And again, this is a little exhausting topic because it has a lot of things which we have, forgotten. And it is important to brush through it and have a good hang of it before you appear for your exam, okay? So this is a common syllabus for your part 1 exam, that is FOP and TS, right? Moving ahead with the useful resources. So before starting this, let me tell you that a lot of people suggest different resources, but here I will be sharing with you resources which have been helpful for me. So practically from now, I would be sharing you my journey and sharing you what actually was helpful for me in passing my exam. And believe me, when I did it, I was in my residency days. It was during my residency of 3 years of pediatrics where I did it, and it was with a lot of work that I decided to give this exam. But I happened to clear it because I had a focus approach, and what is required for that, I soon let you know. So before sharing you this resource, let me first tell you that there is something very important you need to have before you start. That is strong intention. Okay, so strong intention is something you need to have before you go for this exam, right? And this exam is one such where you need to, register first and then book your exam slot. And then again, you have some 1.5 months to 2 months remaining with you after you book your slot for exam and then to appear for the exam. So there is a gap. And it should be, there should be a point in your preparation and in your journey where you need to decide and you need to have that strong intention that yes, I'll give this exam and I'll clear it, okay? And it will be coming much in advance, much before you give the exam and much before you book for the exam, okay? So starting with the duration, you need to give 3 to 4 months for your part 1 preparation, right? And if you are a beginner, if you are someone who is new to pediatrics, I suggest you give proper 6 months or even more than that, because you need to understand, read pediatrics and build your basics in it, okay? We are not just reading all of this to clear exam, we are reading to be good clinicians, right? So you cannot compromise on your basic knowledge. And if you are new to pediatrics, please give some time and have a good hang of the subject, have good basics, and then try to build upon with the high yielding topics which are important for the exam. But first, have a good thorough read of the books, right? But if you're someone who has already some experience in pediatrics, if you have already done your post graduation in pediatrics, then you need about 3 to 4 months, which would be good enough to prepare for the exam, right? So how to go about it? Let's see. So these are some useful resources for FOP. It consists of clinical cases of MRCPCH, Foundation of Practice. Now, this is a book which is given by RCPCH, and it is a lovely book. It consists of 50 questions And these 50 questions have very elaborated explanation. And the book entirely consists of question and explanation. So the question have been formulated very beautifully, and the explanation is, very amazing. And once you read it, once you solve those questions, once you read the explanation, you get good understanding of that particular topic which is being discussed in that question. It gives you a clear framework. Why is this option correct and why are other options wrong? So as I told you, the questions are beautifully framed and the explanation is out of this world. Okay, so this is a must-do book. First of all, because it's one which is given by RCPCH, so we cannot miss upon reading it. The second thing is it focuses on very high link topics. So there are some topics which RCPCH loves to ask. Okay, and these are also those conditions, diseases which are commonly seen in their setup. So why should they not ask you that? So I'll answer to that question. Where do you find that resources by the end of the session? So yeah, I was talking about why this book. So yes, it discusses important topics, so that once you just go through the entire book, you will be done with about 40% of your high-link topics from that book itself, right? And yeah, so that's one very good resource. The second is Science of Pediatrics, which is like a textbook given again by RCPCH, and it's a very lovely textbook. If you are new to pediatrics, you must read this book, because it very beautifully explains the topic, and it deals with the basics, right? So it's a good book to go for. And also, if you are someone who has who has left academics, you know, since long, and you are into practice, but you have lost your touch with books, then again, this book is a simple one to go for. Okay, so I recommend this book for FOP and TS both, and this is the one I read during my exam, because it was easy to read, and you could quickly um, turn over the pages and just highlight the important points and make notes of it. Then comes Illustrated Textbook of Pediatrics, which is again a textbook, and it again deals with the basics. Again, a very lovely book. And why do I mention both these books together? Because there are some topics which haven't been covered in Science of Pediatrics, which has been covered in Illustrated Textbook, and vice versa. So it's good to go with both these books together. Okay, they're not very extensive. Yes, they are, a little um, voluminous book, but again, if you start reading, you will eventually realize that it's easy to just read and turn over the pages. It won't take much of your time like huge books like Nielsen and Harrison do. So yeah, these are two lovely books which I have read during my exam, and they have come out to be very handy. Okay, then comes the pediatric guidelines and the neonatal guidelines and NICE guidelines. So these are set of guidelines which has been given by the UK standards, and these are the ones which are being followed there. So yes, this exam judges your knowledge based on the UK standards. Okay, so if there is a question regarding asthma, and they ask you which is the like what would be, you are giving so and so treatment, and the child does not respond to it, so what is the next best treatment to go for? So there are different guidelines given across the world, and your country may be following different set of guidelines. But to appear for this exam, you should be well aware of the guidelines that are being followed in UK. Okay, so that way these guidelines are important, but there are a lot of them. There are a lot of them. So they have guidelines for almost all the commonly seen conditions in their setup, and this way there are n number of guidelines to read through. But you do not need to do that. for this exam, there are few topics which are commonly being asked and for which you need to be thorough with the guidelines. For example, asthma, for example, uh, DKA, for example, UTI. So these are commonly asked questions whereby you need to be thorough with the guidelines. And, we eventually guide you how to read these guidelines during our sessions, okay? Because they are quite extensive and we need to simplify it for you and tell you that, okay, read it this way. You can skip this part. You can skip these guidelines. You need to focus on these guidelines or something which, we keep on guiding you along. And then comes RCPCH sample paper. Again, something given by RCPCH themselves. So it is a must do. You cannot skip this. Moreover, these sample papers are helpful in the fact that they they have questions which are very much similar to what you get in your real exam. So in your real exam, you need to understand that the questions are lengthy. It takes some time to read through the questions. But despite having read all the question, in the end, suppose if you are given a clinical scenario of celiac disease where a child of 1 year age presents to you with failure to thrive, abdominal distension, pallor, and then there is diarrhea, and you are suspecting at the back of your mind it is celiac disease, and you're going through the blood reports which have been given to you in the exam, the clinical picture, the on examination finding, and you read through all of it, but at the end they have again mentioned in their question itself that it is a case of celiac disease. And the options, they are basically trying to judge your pathology. They want to know from you what is the pathogenesis behind celiac disease. Okay, so this has also happened with us. And when I was sitting for my exam, and I used to go through the question, and I used to start from the first line, read it like, oh my god, this is a case, and then they will be asking me what is the diagnosis and how do I manage this. So my mind used to work like that, and then at the end of the question I used to see they have already given the diagnosis, and now they want to ask what is the pathophysiology. So this is how they frame their questions, and you need to um, strategize how to read through that that entire stem of question and come to the answer, and not to waste a lot of time in one question, not to waste a lot of time behind one question. So this way RCPCH sample papers are helpful. They help you strategize how to appear for the exam, because how much time to give to one question and how to read through the entire stem of the question quickly and approach the options is what you easily get to know with the sample paper. Then comes past recall. Now, let me tell you that recalls are very important part of your preparation, okay? So this is very important, but you need to be cautious because there are a lot of people who say that MRCPCH exam is easy. You just need to read through the recalls. Need to be, you just need to mug up the recalls and go and sit for the exam. No, that's not the case. The exam consists of questions which are high yielding, which they have asked from topics they have asked before, but now they are changing the question type. They are changing questions. They're not repeating the same question. So there is no meaning if you mug up a recall paper and then sit for the exam. You need to pick up high yielding topics from the recall, sit with those topics, open both the books, illustrated textbook and Science of Pediatrics, read through that topic extensively, make notes, solve questions from the topics from the question bank, and then you are ready with that subtopic. This is how recall helps you in picking up in picking up high link topics, and also it helps you understand what kind of question they like to ask, right? So a recall should be used in this way and not to mug up and just you know um, try to have shortcuts which would eventually land you up in trouble. So recalls are important, and I have told you how to use them. And also, in the subsequent slides, I have also discussed about this separately. So I'll be talking about that in detail. Meanwhile, also let me tell you that FOP TAS is also one of the resource which is used worldwide. But to be very honest, I did not use FOP TAS, and I had cleared my exam, and I never felt the need of it because there was nothing that I missed upon, and I could cover quite a lot by following these resources and the question banks, right? Coming to the next one, useful resources for TAs. So let me highlight the point that if you're preparing for both TS and FOP, I would suggest you to read both the textbook Science of Pediatrics and illustrated textbook. But here I have not mentioned illustrated textbook because of the fact that if you're someone preparing only for TAS, you can it's ideal to go for both the book Science of Pediatrics and illustrated textbook. But if you have shortage of time, it's okay if you read Science of Pediatrics only, because there are a lot of other things you need to cover for your TS exam. That is a lot of PDFs which consist of ethic files and pharmacology file and also statistics. So these things are the ones which have to be done extensively because they are, they have a lot of weightage in the TS exam, right? So that's about the textbook. And about clinical cases of MRCPCH for theory and science. Again, this book is the similar book which we have for FOP. So these are two separate books, clinical cases for FOP and clinical cases for TAs. Both of them consist of 50 questions each. And as I told you, they have discussed about a subtopic, asked questions from it, and explained. So make sure that you do that. And then Science of Pediatrics, as I already told you, is a good core book to have. Then again, RCPCH sample papers are must do, past recalls are must do. And then there are some PDFs that I told you, which needs to be done before you appear for your TS exam, right? So that's about the useful resources for FOP and TS. Then comes study tips, okay? So again, here I'll be going this way, how I did for my exam and what ways were helpful for me, right? So I'll be sharing my experience. So as I told you, 3 to 4 months are good to prepare for your MRCPCH part 1, but only if you are someone who has experience in pediatrics, right? And if you are someone new to pediatrics, you need to give yourself good amount of time. Now, aim for at least 2 to 3 hours per day. You need to be consistent. I would suggest that I would want to share that consistency was one thing which was helpful for me. I used to give 2 to 3 hours every day. I used to be very tired with the work that I had during my residency, but still I made sure that I sit with my book, my study material for MRCPCH for at least 2 to 3 hours per day, be it the early morning hours, be it the late night hours, but you need to give some time for your preparation, which should be at least 2 to 3 hours per day. And then for those days when you have your day off, so when there are weekends, you can give more time, right? And you need to split your time. Give If you're appearing for both TS and FOP together, you need to, first of all, read the textbook thoroughly, which would be helpful for both the exams. But when it comes to solving questions, you need to give time separately for question banks of FOP and for question banks of TS, because as I told you, both these exams differ in the type of questions being asked and not really the syllabus. Okay. And yes, definitely you need to practice questions daily. How do you do it? In the initial part of your preparation. So if you are preparing for 4 months, then the initial 2 months, you need to read your theory more and give some time for practicing question. But in the later half of your preparation, you need to give more time to question solving, and then you need to build upon by going back to the book and making sure that you build upon your weak areas, right? So that's how you go about studying for your part 1 exam. Then comes using recalls and repetition. So how do we usually suggest? How did I do it? I used to attend live session of a topic and then I used to go back and read the same topic from the textbook. So I used to read from, I tried reading one topic from both the textbook, Science of Pediatrics and Illustrated textbook, and then I used to make notes of them, and then I used to solve questions of the same subtopic. So suppose if I have covered CVS today, then I have made notes from Science of Pediatrics and Illustrated textbook. Then I go on to solve questions from the question bank from CVS. And then I used to also take help of recalls to understand what type of questions have been asked in the past, right? And then if I used to find that there are some things which are new, which haven't been there in the book, which has not been given in the question bank, but it was asked in one of the exam, then I go and read that again, make sure that I add that into my notes. Okay, so this way I have built up uh, an extensive notebook for my FOP and TS preparation, and that was the you know the the basic thing and the base of my revision. It made my revision very easy. So that's about notes. And the second thing is, yeah. So after having solved question banks and recalls, I used to solve clinical cases of those subtopics. Suppose I have done CVS, then I'll be solving those questions from clinical cases of textbook, which are a part of CVS. Okay, and this study method is so effective that that's what I follow during my live sessions also. So when I take a live session, I make sure that I have accumulated all the important things from both Science of Pediatrics illustrated textbook and from other sources which I have felt useful. And then after having explained the topic, I make sure that I include questions from clinical cases which are a part of CVS or whichever topic I'm teaching. And then I go about giving you some questions which are there from the question bank, and then followed up with questions from the recalls. Okay, so that's how I follow my live session pattern, giving you high yielding content from all the areas, from all the important resources, Science of Pediatrics illustrated textbook and other resources, followed by clinical cases, followed by questions from question bank, followed by questions from the records. Okay, so that's what makes you read that topic and understand that topic thoroughly, along with knowing your exam. In the sense, it also solving question bank and recalls also helps you understand what thing you need to focus for your MRCPCH exam, right? Because pediatrics is something you can keep on reading and reading, and there is no end to it. You have to put a full stop and read it in accordance with the exam. That's very important. Then flashcards are something which help you consolidate high yielding facts. And what I used to do was I used to write up volatile things into a piece of paper, and I used to stick it near my bedroom, near my bed in my room, because that was the place I used to spend most of my time whenever I was at my room. And even having a glance of it gives you that input, and your mind registers that each day. Okay, so by the end of your exam, you at least have a picture memory, and when you see that same thing in your exam, you are at least able to pick up the correct answer, because at the end of the day, it is multiple choice question. The answer is in front of you. You just need to identify, okay, yes, this is the right answer. So even that picture memory helps you a lot, right? Then don't just read, test yourself daily with MCQs is what I suggest. Okay. Coming up, coming up next, focus on high yielding topics. So as I said, pediatrics is so vast, you can keep on reading, but you need to make sure that you read the high yielding topics to clear your MRCPCH exam. And high yielding topics are something which you can pick up with the recalls. And if you are with us, then you do not have to worry at all. We do the homework of finding out the high yielding topics, putting it up together, and giving it to you. Okay. Then comes mock exam. So this is something which is very, very, very important to give before your exam, because whenever we are reading for an exam, we are so much into the content that we just keep on reading, reading, reading. And solving a question bank, solving recalls is very different from solving the mock exam, because the recalls, the question banks have questions stem which are very small. Recalls are based upon what the candidates have in their memory after coming back from the exam. And do you think someone would remember minute details of the question? No, they just remember the keywords, and based on that, a recall is being framed, right? But the question, as I told you, are lengthy. They have a lot of details into it, right? So, how to read that quickly, how to answer your, answer fast, and how to manage time is something which you get to know by solving the mock exam. So it's very important to sit for mock exam. Also, it stimulates the real exam. So it gives you adrenaline rush of, solving 100 questions in a given time. And that adrenaline rush, that panicky situation is must to have before your real exam. Okay. You need to also get used to that adrenaline rush and helping it focus more, and pushing it more to perform better. So all these things you know get to know better and understand better once you give the mock exam, right? So that, and then comes recalls for preparation. Now I have made a separate slide for this because recalls are very, very important. As I told you, they are must do. And this is something which I would suggest you do during your second half of the preparation, because I do not want you to limit your knowledge or limit your study just around the recall. Make sure that you understand the fact that recalls will guide you what you have to read, but that's not all you have to read. Okay, you need to read things in a little more depth. Recalls will just help you understand what kind of questions they are targeting. But yeah, so that's the reason why I suggest to read this in the second half of the preparation, so that you do, get biased. And there are recalls available which are year wise and also topic wise. So you can also solve them topic wise if you have covered one topic and then go about solving recalls. So you can do it topic wise, and you can even do it year wise, because we do not suggest going back to very old recalls. It's okay if you just do last 3 to 4 years of recalls, that is good enough. Now, how are the recalls different from the real questions? As I told you, recalls are based upon what the candidates have recalled after they have given the exam. So, yes, the questions are very small. They just consist of the keywords, and that's how they differ from the real exam. So, when I solved the recalls and when I went to sit for my real exam, I was a little shocked because all the questions were so big, and that's not the case with recalls. Okay, so keep in your mind, recalls is just giving you the keywords related to that question, and they are not the exact kind of question which will come to you in your exam. And also, there are some recalls which are, little confusing, because um, at the end of the day, the information given in it is based upon the recall thing, and it may not be completely correct. So that makes it little difficult for us to you know make the key for a recall, because the given options and the given question may differ. And this problem is a big problem with biostatistics, because the questions are huge, they consist of a lot of numbers, and most of the statistics recalls are a little incorrect. So you have to be very cautious, and you just need to understand that though these are the things which have been asked, so you need to go back to your PDFs and read those things extensively, so that whenever any question is asked from the same topic, you are able to ask. Okay, don't get into the recall thing, and do not get worried if you cannot find answer to one of the recall. Okay, and the right way of doing it is to know the topic which are important, know why is that particular question correct and why are other options wrong. So whenever you're solving a question, when you know that this option is correct, that's good. But you also should know why other options wrong. And you need to have a little correlation, okay? So that's how you prepare with the help of reports. Then comes in the last 2 months. So in the last 2 months, read notes. I know most of us may not have the habit of making notes, but it comes very handy, especially in the last few days where you need to revise the entire syllabus in 1 to 2 weeks. Okay. And I suggest doing that. At least revise 2 to 3 times before you appear for your exam, because you need to consolidate those things which you have read once, right? Then focus on high-yielding topics during the last few months, and do not forget the importance of revision. Please revise before your exam and invest half of your time in studying and the other half in solving questions. Please manage your time well in the last few days, and if you are someone who is working, please take leave. Okay, do not shy away. Please take leave, and in the last 1 to 2 weeks before your exam, you need to leave everything else behind and sit with your book and sit with your content. That's very important. Okay, you cannot just afford to juggle up job and reading and everything together in the last few days before your exam. And as I said, recalls are must do, especially in the last 2 months. And that's when you identify your weak areas, and those weak areas needs to be supplemented with extra reading. Okay. Now, on exam day, how to attempt questions. So read questions carefully, focus on keywords, don't miss out on words like except, or which is a false, or which is a true one. Keep track of time, divide your exam question into slot of times, okay, that you need to do for 50 questions in this much time, and then the next 50 questions in this much time. Believe in your first instinct, avoid making any changes into your answer during the second check. I have made this mistake most of the times. Whenever I go through my answers for the second time, I make changes and they turn out to be wrong. The first thing which I have marked with my first instinct usually comes out to be the correct one. Keep yourself hydrated, but do not hydrate yourself. Do not overhydrate yourself, okay? And take deep breaths in between. Right. So as I promised, we are going to solve questions related to cardiac catheterization, which is a very important topic. And since last 3 days, they have been asking this consecutively. So they asked this in the October 2024 paper. They have asked this in February 2025. Okay, so they have been asking it very often, and that makes it a very star topic. So let's have a read of it. Let's understand how to solve questions. So in your MRCPCH exam, you usually do not worry about remembering facts, but for cardiac catheterization, let me tell you, you need to remember the normal saturation and normal pressure in all the chambers of heart. Okay, so the table which has been given in front of you should be, in your mind thoroughly. So you can see here the right atrium has saturation of 65% in a normal person and the pressure of 40 mmHg. Then the right ventricle has saturation of 65, which is similar to right atrium, and the pressure is 25/4 mmHg. Pulmonary artery has same saturation as right atrium, right ventricle, but a pressure of 25/15. Now come to the left side of the heart. Left atrium has saturation of 99 with pressure of 6 mmHg. And the left ventricle has same saturation 98 with pressure of 35/6. And aorta has saturation of 97%, 97 to 100% with pressure of 75/50, but this increases with age. Okay, so this pressure of aorta corresponds to the normal pressure that we measure in the periphery, in the brachial artery mostly. So it corresponds to that, and it changes with age. So for a child who is 10 years of age, maybe a pressure of 100/60 being normal for aorta. Okay, so that depends on the age. Now coming to steps that you need to follow for solving questions related to cardiac catheterization. So first thing first, you need to check the saturation in aorta. Okay, so look at the saturation in aorta, because that is going to tell you if the condition is a cyanotic heart disease or it is acyanotic heart disease. So if the saturation is more than 90 to 95%, then you are dealing with acyanotic heart disease. And understand that they are not going to do cardiac catheterization for a normal person, right? So only if they're suspecting a congenital heart disease, they are going to go for cardiac catheterization. So a normal saturation would be, going towards acyanotic heart disease, which is ASD, VSD, and PDA. Then if the saturation is less than 80 to 89%, then we are dealing with cyanotic heart disease, which mostly consists of TOF and TGA. But there are other conditions also which they have now started asking. So the first thing first, you need to look at the saturation in aorta, which will at least narrow down your differentials to cyanotic and acyanotic. Then the second thing is to check the abnormal saturation. So the saturation may be abnormally increased, the saturation may be abnormally decreased in some of the chambers given to you. So if a particular chamber is showing increase in the saturation, suppose if there is increase in the saturation of the right atrium usually has a saturation of 65. So if there is increase in the saturation of right atrium, that is abnormal, that is not normal, right? And if it is abnormally increased saturation, then you need to think of left to right shunt. Why? Because the left side of the heart consists of oxygenated blood, the right side of the heart consists of deoxygenated blood. But if there is increase in the saturation, that tells you that there is some shunting of blood from the left side to the right side. I hope you understand the point. Then talking about decrease in the saturation. So if there is abnormal decrease in the saturation, suppose the left atrium, or let's talk about the left ventricle. So the left ventricle has normally a saturation of 98 to 100%. So if there is decrease in the saturation, if the saturation is 70%, or let's say if the aorta has saturation of 70%, then then you need to think about right to left shunt. Why? Because again, the right side consists of deoxygenated blood and the left side consists of oxygenated blood. So if there is decrease in the saturation in the left side of the heart, there must be some shunting from the right side. Okay, so that's the second and the third step to follow, to check for abnormal decrease and increase in the saturation of all the chambers of the heart. You need to check for the saturation in all the chambers of the heart and compare it with the normal one and come to a conclusion if there is abnormal increase or abnormal decrease. The fourth thing is to look for pressure changes. So you know the normal pressures which are there in individual chamber. You need to compare the pressure which is given to you in the question with the normal pressures and check if there is abnormal increase or decrease in the pressure. How is that going to help you solve the question? I'll eventually let you know. So this is a schematic diagram which you need to make before solving questions for cardiac catheterization. So in your exam, you'll be given a blank paper, and I would say it is must to make this diagram. Okay, do not just go about solving the question in your mind. Make this diagram, and let me help you with this. So if suppose you have a question, let's solve a question together. So there is a question which talks about, and you are given the right atrium, okay, right atrium, right ventricle, left atrium, left ventricle, pulmonary artery, and aorta. Okay, and now you're given the saturation of right atrium as 65. This is 80. This is again 80. And here you have saturation of 98, 98, 98. Now tell me, how do you approach this question? So the first thing first, you need to check for saturation in aorta. Okay, so here the saturation is 98%. Now tell me, what do you think? Is it acyanotic condition or cyanotic condition? So this is clearly acyanotic condition. Okay. Now my differentials would be AST, VST, and PDA. Okay. Now the second step, to look for abnormal increase or decrease in saturation. Okay. Some of you have already given the answer, and that's amazing. That's lovely. Okay. So here, let me just solve the question, because for those who have not yet understood how to solve it, I would explain it. So here you can see that there is abnormal increase in the saturation. Okay, ideally it should have been 65, 65, and here 65. So there is abnormal increase here and here. So this point here in this chamber, this is the first point where there is abnormal increase in the saturation. Why should this be like that? As I told you, the left side has low saturation because of deoxygenated blood. Sorry, I'm so sorry. The left side has high saturation because of oxygenated blood, and the right side has low saturation because of deoxygenated blood. But if there is increase in the saturation here, it may be because of some shunting from left side to the right side. Okay, and it must be at this point, because this is the point where the abnormal saturation has started, right? I do not expect it here because here the saturation is normal, right? So there's a shunt here from left side to the right side. Seen in case of VSD. Okay, so this is a case of VSD. And this question we were able to solve even without looking at the pressures. But yes, it's a good habit to even check with pressures also. Okay, they have mentioned pressures in all the questions, and in this question, in this particular question, the pressures would have been same as the normal physiological pressures. Now, let's solve another question together. Here you have right atrium, and the saturation here is 65. Here the saturation is 65. Here the saturation is 90, 98, 98, 98. Okay. Now tell me, how do you go about this question? So first thing first, aorta. Look at the saturation in aorta. What do you think it is? It is acyanotic condition. Okay. What do I need to think about? AST, VST, PDA. Okay. And out of all these, tell me, what is this condition? And where is the abnormal increase or decrease in the pressure? So, saturation. So this is the point where there is abnormal increase in the saturation. This is a normal saturation. This is a normal saturation for that particular chamber. But in the pulmonary trunk, the saturation has increased. So what do you think this condition is? Right. So you guys have given the correct answer. And yes, it's a PDA, because here we are thinking about shunt from left to right side. Okay, that is here at this point. So there is going to be a left to right shunt at the level of aorta and your pulmonary artery, right? Because as I said, the left side consists of oxygenated blood and the right side consists of deoxygenated blood, and there has to be some mixing between these two to give abnormal increase in the saturation in pulmonary artery. Okay, so this is a case of PDA. And if you check the pressures, then the pressure would be corresponding with the normal physiological pressure. There is no pressure abnormality seen in PDA. Now let's look at another scenario. Right atrium. Okay. Right atrium, the saturation that you have been given is 65. Here you have 80, 80, 85, 85, 85. And here I would also want you to know the pressures. So pressures here is 4. And let me write pressure with some other color so that you do not get confused. So pressure here is 4, and the pressure here would be, right? And here it would be, okay? Here I would put the pressure of 6, and here it should be. Okay. Now tell me, what is this condition? And how do we go about? If one of you wants to open the mic and give all the steps, you're most welcome.
Hello, ma'am. Hello.
Yeah, anyone? Yeah, can you be a little louder, doctor?
Yeah. The saturation in the left side is decreased in left atrium, left ventricle, and aorta. And the pressure in the left in aorta also pressure in saturation in the left and the right ventricle is increased, and pulmonary vein is increased. So for saturation, it is decreased in the left side and increase in the right side.
Right.
And
So
came to
the first thing, but you need to tell me the first step first. Let's not skip that. So about aorta, what do you think?
aorta, there is a decrease in the saturation and increase in the
Right.
decrease in the pressure.
So what do you think this condition is? What is the subcategory? Is it cyanotic or acyanotic?
Cyanotic.
Perfect. Now tell me what the second step is, if there is abnormal increase or decrease in the saturation. First, let's solve that. So where do you think there is abnormal increase or decrease in saturation?
This is either tough or transposition of great arteries.
That's what I'm saying. Let's solve it stepwise, and you tell me where there is abnormal increase or decrease in the saturation.
In the left, in the decrease in the saturation in the left ventricle and increase in the right ventricle.
Right.
Decrease in
So, yeah.
and increase saturation also in the pulmonary artery. Increase in saturation. Well, this is most probably this left to right, right to left shunt.
Mm-hmm.
So left to right shunt, which is mm, it could be tough.
Okay, so first let's enumerate this, whatever you have said. You say that there is decrease in the saturation of left atrium, left ventricle, and also aorta. Okay, and this is in correspondence with cyanotic heart disease. So I think because this is a cyanotic heart disease, all there is deoxygenated blood flowing in the left part, which is giving this. But you also see that there is abnormal increase in the saturation of right ventricle and subsequently
Yeah.
the pulmonary artery, which is a
Yeah.
little weird. Why should that happen in cyanotic heart disease? So there must be
Transposition.
some shunting happening here, right? Do you agree with
Yeah.
me?
Yeah.
Yeah. So you agree with the fact that there is some shunting happening in this case. Okay.
Mm.
So there is definitely a VSD, and someone is saying VSD with PS. That's great, but VSD with the right ventricle outflow tract obstruction. What is this condition? Okay, so let's again go stepwise, and
Trans,
we have figured out that there is a VSD here. Now
trans,
come to the
trans,
third point. Yes, yes. You guys are giving me the right answer. I can see that you have already reach to it. But let's come to the third point, the pressures. Now, tell me, where do you think the pressure is abnormal? See, first of all, looking at this
Pressure
point,
pressure abnormal in the aorta, it's abnormal. In the left right ventricle, it's abnormal. And also in the pulmonary artery, abnormal.
okay, so why this is abnormal? Okay, this is abnormally high, and this is
Yeah,
abnormally low compared to what it should have been. So
yes.
it is always more than the right ventricle, but this is lower than that, and this is high. But why do you say that the pressure is abnormal in aorta?
Supposed to be 75.
Right, but when I said that, I also told you that the pressure in the aorta also depends on the age of the
Depend on
baby.
the age, yeah. Yeah, depend on
Yeah.
the age.
So what
So
if this child is a 5-year-old or a 4-year-old? Then the
we
pressure is
didn't,
normal, right?
yeah, normal.
Do you agree?
Depend
Yeah.
on, but
So,
because we didn't have the age.
sorry.
We didn't have the age of the at this
Yeah, of
scenario.
course. So that's my bad. I'm so sorry. I should have given you the age of the child, right? But yes, this is normal. 90 by 60 is normal for a pediatric age group. Okay. It's not high. Even if I had written 100 by 68, that should have been normal. Okay. So the third thing is to look at the pressures, and we have figured out that there is abnormal increase in the pressure of right ventricle and abnormal decrease in the pressure of pulmonary artery. Now, this suggests that there is some kind of stenosis here. There's some kind of obstruction here at the level of right ventricle and between the right ventricle and the pulmonary artery, which is RVOTO. That is right ventricle outflow tract obstruction. And VSD with right ventricle outflow tract obstruction is a component of
TikTok.
tetralogy of Fallot. Okay, so you're very right, Dr. Kapta. This is a condition tough, right? But you also understood the importance of going stepwise. We may have solved 10 questions, we may have solved 50 questions, but I still suggest for cardiac catheterization, you go stepwise. Okay, right? Do you agree?
Yeah.
Okay, perfect. So this is tough, and I have explained you why it's tough, and again why it's important to follow all the 3 steps of cardiac catheterization, right? Now, I have one more example, one more question for you to solve, and then followed by that, we have 2 recalls, which has been asked in the recent past in February 2025 paper and also October 2024 paper. Okay, so before that, let's solve just one more question quickly, and I know you guys are going to tell me fast. You all are brilliant, brilliant. So this is right ventricle with the saturation of 65. Here 65. In pulmonary artery, it is 90. Now in left atrium, it's 95. 95. Let's take it as 95. In the aorta, it is 80. Now you guys tell me what is the condition. And the pressures are normal. The pressures are normal in all chamber. What condition is this? So does anyone else want to? Okay, doctor, you're right. This is a cyanotic condition. So does someone else want to just open up their mic and solve this question with me step by step?
Yeah, so first starting with the aorta saturation. So saturation of aorta is 80, so that is decrease. Now,
Okay,
so it is cyanotic. So cyanotic, there might be TOF, TGA, TAPAVPR, or tricuspid atresia like this. Okay,
perfect.
now coming towards the uh, pressure increase or decrease. So there is pressure increase in the pulmonary artery, and there is pressure decrease in the uh, saturation increase in the pulmonary artery and
Yeah.
saturation decrease in the aorta.
Mm-hmm.
Okay, and
Then,
now comes
yeah.
toward the third step. The pressure is not mentioned. So coming toward this,
Pressure is normal in all chamber is what I have mentioned there. Pressure is normal here.
so there is abnormal increase in saturation in pulmonary artery and decrease in aorta. So it might be like switching of these pulmonary these vessels. So it might be TGA.
Perfect, perfect. So here, as Dr. very well said that this is a cyanotic condition because the saturation of aorta is 80%, and there is abnormal increase in the pulmonary artery saturation, abnormal decrease in the saturation in aorta, and the pressures are normal in all the chamber. So this is suggesting transposition of great arteries. Okay, this is TGA for you, right? I hope this is clear to all of you. Is there any doubt? Is there any doubt regarding cardiac catheterization? So if there are no doubts regarding this, let's solve some recalls related to cardiac catheterization. And these are recent recalls, very important. So this question was asked in October 2024 DITE, and it says child presented with syncopal attack, cardiac catheterization was done, cardiac catheter showed following readings. So as I told you, I'll make a schematic diagram here. Okay, and you guys help me solve this. So right atrium 79, right ventricle 79, SVC also 79. So okay, that's fine. Then the pulmonary artery is 80. The left ventricle is 98. The femoral is 98, and they haven't mentioned for left atrium here. Right, then let's look at the pressures. The pressure in SVC is not given here. There is a dash. The pressure here is 3, which is normal. Right ventricle, it is 40 by 30. And in pulmonary artery, it is 40 by 10. And in the left ventricle, it is 130 by 60. And in the femoral artery here, somewhere down here, it is 80 by 60. So now tell me, what do you think it is? So first of all, let me solve it for you stepwise. And I'm not very sure the numbers which are given here were very much same as what it was asked in the question, because again, it's a recall. But if we look for the, saturation, the aorta shows saturation of 98%. Okay, so aorta, they haven't mentioned, they have mentioned femoral artery, but then again is going to correspond with aorta, it is 98%, right? So which is normal, and we are going to think of a cyanotic condition. The second thing is abnormal increase or decrease in the saturation. So if you see here, the saturation altogether in the SVC, right atrium, right ventricle, pulmonary artery is corresponding with each other, and they are same. There is no abnormal increase in the saturation. So that's normal. So the right side of the heart is normal. There is no shunting. The left side also has normal saturation. So there is no shunting as such, okay? So the saturations are normal. Coming to the third step, the pressures. So the pressure in the right atrium is fine. The right ventricle is a little on the higher side, but the pulmonary artery is a little low, but the difference is not much. There's not much significant difference here. But here, look at this. Left ventricle shows a pressure of 130. This is way too high, okay? So 130 by 60. Okay, doctor, before you give that answer, let's look at this in a little more detail. So 130 by 60 is high, even for adolescent, even for an adolescent. This is high, 130 by 60. But they have not given the age, but still this is considered as high. Moreover, if you look at the pressure in the femoral artery, it is 80 by 60. So had it been a normal person, the pressure in the peripheral artery would any day be higher than the pressure in the left ventricle. Okay, so the pressure in the femoral artery is low here. So there is an abnormal low pressure in femoral artery and high pressure in left ventricle. So there has to be some obstruction at this level between the left ventricle and the peripheral artery. So this could have been a case of either aortic stenosis, or it could have even been coarctation of aorta. Okay, but had they given you coarctation of aorta, they would have given you, a proper age group maybe. But here, the only option that they have given is aortic stenosis. So this is the option which is correct. There is some obstruction at the level of left ventricle, between the left ventricle and the pulmonary artery. Okay, and here it would be at the level of aorta, at the end of the aorta, giving such high pressures in the left ventricle. So the left ventricle is jam packed because it's not able to push blood outside the aorta, right? So that's aortic stenosis for you. I hope this is clear to you all. Is it? So I hope you have understood why it is not mitral stenosis, because there is the pressure difference. What happens in a case of stenosis is the part which is proximal to it, it will have abnormal high pressure, and the part which is distal to it will have abnormal low pressure. That's how we decide the point of stenosis or atresia. Okay, so because the difference was not there between left atrium and the left ventricle, that's why it's not mitral stenosis, and it is a case of aortic stenosis, right? Moving on to the next one. Now, this question was given, this question was asked in February 2025 question paper. And it said cardiac catheterization of 1-year-old baby showed uh, following saturations. So let me make the schematic diagram. Saturation in right atrium is 74. Saturation in the left ventricle is 74. Sorry, right ventricle is 74. In the pulmonary artery, it is 84%. And in left atrium, it is again 84%. And in the left ventricle, it is 84%. Okay. In the aorta, they haven't mentioned the saturation. They have just written here AO normal. Okay. I'm not aware of this, but maybe they are talking about the aortic pressure. Aortic pressure is normal. They have not mentioned the saturation in aorta. Was it the same in the question paper? I'm not sure. Usually they mention saturation of all the chambers. Okay, because cardiac catheterization is done to know everything. Okay, such invasive thing is not just done to, you know, give half of the information. So there should have been aortic saturation also mentioned here. But okay, this is not given here. Let's go ahead with that. And let's look at the pressures. So it is 8 here. It is 88 by 20 here. 18 by 3 here. 7. Here they have mentioned normal pressure. And here also they have mentioned normal pressure. Okay. Now, what do you think this condition is? So I'm getting the right answers here. And you guys are right. We again solve this in the same way. The aortic saturation has not been mentioned here. So the second step is to look at the abnormal increase or decrease in the, yeah, but yes, you guys are right. It has to be cyanotic, because the left chamber is showing saturation of 84%, 84%. Okay. Now, talking about abnormal increase or decrease in the saturation. So there is abnormal increase in the saturation of pulmonary artery, although it has not reflected in the right ventricle, or I'm not sure if this was the same number given in the exam. But yes, there is increase in the saturation of pulmonary artery. Along with that, there is significant pressure difference here. So there is abnormal high pressure in the right ventricle and abnormal low pressure in the pulmonary artery, which clearly suggests that there is some right ventricle outflow tract obstruction. Okay. So with this given scenario where you have acyanotic, where you have cyanotic condition with the right ventricle outflow tract obstruction and some signs of shunt here, this is a case of TOP for you. Okay. And these were the options given to you in the exam. And it was quite easy to pick up tetralogy of Fallot because, here in the recall, they gave just 3 options. And out of these, there's just one which is cyanotic, and that is tetralogy of Fallot. Okay. So these were the 2 recent recalls that were asked regarding cardiac catheterization, which we have just discussed. And I hope now that we have attended this session, you would not mark any question wrong considering this particular topic, which is very, very important for your upcoming diet of MRCPCH Part 1, right? And I would be concluding this session, giving you a quick brief about the course that we have, MRCPCH regular course, which is going to commence on 10th of July. And it will be a 3.5-month course, which will give you 20 topic-wise live session, 10 of FOP and 10 of TAS. Okay. And I conduct the TAS sessions, and my co-mentor, Dr. Nida, conducts FOP sessions. Okay. And I have given you an outline of how do we make our live session, which consists of all the high-yielding topics from all the important resources. Then we follow it up with questions of clinical cases, so that, with our live sessions, you are also solving your clinical cases, right? We are doing it simultaneously. And then we give you some questions from recalls and also some questions from the question bank related to the same topic. Okay. Then the second thing is, if you happen to miss out on the live session, then you can go and go up to the website, and you have access to the recordings as well. And I would also want to share you that I have used recordings during my revision phase also. I used to do it this way, that whenever I had a very busy day and I had a hectic day, and when I used to when I never felt like reading actively, I used to sit back and listen to the recordings, and that used to be so good way of passively reading, reading a topic. Okay, so that was that's what we give you, recordings, and we also give you PDFs of the session that we conduct. Then you have the recalls available with you. So we have recall PDF with, and that to solve recalls. Okay, with that you get question bank, which consists of 3,000 questions in FOP and 2,000 questions in TAS, right? And then there is mock exam, which is made available to you, which is very, very, very important to solve before you appear for your real exam. And then someone was asking about resources. So you get all the resources at one place, which includes all the books which I have enumerated: the science of pediatrics, the illustrated textbook, and all the important PDFs, the statistics PDF, the ethics PDF, and also pharmacology PDF. We make it available to you on our website, right? So I hope I have answered your question. Then you have the notes for FOP and TS, separate notes for FOP and TS, and then there is a study group in the WhatsApp, whereby the coordinators, they post questions every day. They post multiple choice questions every day, and by the end of the day, they give you the key of those questions. So that also keeps you consistent in solving questions. And I love the way they are so regular with posting questions. And then we also discuss a lot of queries in the group. We also discuss a lot of tips and tricks in the group. And also there is this beautiful thing that sometimes you guys approach in the group, and sometimes you approach personally with your dilemma, with your doubts, with your, when you are mentally exhausted, and when you seek our help, let me tell you that we are always there to help you, okay, during your entire journey of MRCPCH. And yes, of course, there is a personalized learning dashboard on our website, whereby you can keep having a check on your progress with each, question and mock that you're going to take, right? So that's about our course. And now let me just take up with your questions. And I'm so happy that most of you have answered amazingly to the questions of catheterization, that cardiac catheterization that we just saw. And Dr. Meeru, thank you so much for your appreciation. And I'm glad to have you in the course, and waiting for it. Fee structure, Dr. Shah, would be told to you by the coordinators. Please connect to them. They are very friendly, and they are very approachable and very quick to respond. They'll help you with the fee structure. Dr. Kavtar, it was lovely to have you with us, and thank you so much for appreciation. And yes, you are given the number. You can contact that. They'll help you with the entire fee structure. They'll help you with the further details of the course, and also they'll guide you how to register for the course. Are there any doubts related to this session? Related to maybe the preparation part, or maybe the cardiac catheterization topic that we just learned, or are there any doubts related to the course? If there are any, please do let me know. I'm happy to solve your doubts. Thank you, Dr. Sandeep. Thank you so much for being a part of the session. Okay. So I hope there are no doubts. So I would like to conclude this session and wish you all very best of luck, and hope you all come out with flying colors and get through this exam in the first go itself. Best wishes to all of you. Thank you, Doctor. Thank you.